Illinois has a clear roadmap to address the HIV epidemic, and that's the Getting to Zero plan. And that is the 2.0 plan that sets to reduce new HIV diagnoses down to zero by 2030. Federal actions, as we know, are destabilizing HIV care and prevention. Considering the H.R. 1 Medicaid and ACA rollbacks, we know that federal HIV funding cut proposals, NIH funding cuts, are eliminating funding flagged through the DEI executive order. State action is desperately needed to protect access and maintain momentum. The HIV response is equal to public health integrated with the racial equity lens, as we know. And so I want to say thank you to the partners, the advocates, and the community leaders for being here today to keep the pedal on the gas to make sure that we continue to build on the progress that we've made in the last 4 years that I've worked with you to champion. You know, Illinois has made a commitment to ending the HIV epidemic in our state, and it's clearly outlined in that Getting to Zero plan. That's why this moment calls for leadership. Illinois has never been a state that waits for others to solve our challenges. We step up. We lead with data, with compassion, and with commitment to equity. And we know it works. We know that we need to invest in prevention, we need to ensure access to treatment, and we need to support our community-based providers who are doing this work on the front lines. And we need to address these health equities head on. And that is exactly what HIB 4410 and SB 2814 are designed to do. These investments, thanks to the hard work of all of our advocates and folks here who have direct lived experiences, will help to stabilize our HIV care system by protecting access to life-saving services and keep Illinois on track to meet its goals to getting to zero by 2030. Because ending the HIV epidemic is not just a public health goal, it is also about whether every person, regardless of where they live, has access to the care that they need to live a healthy and dignified life. So as we move forward in this legislative session and to budget negotiations, we all must stay focused. We must protect the progress that we have made. We must respond to the challenges in front of us, and we must continue to lead. Illinois has the tools, we have the partnerships. There will not be any austerity debates around the issue of reducing HIV diagnoses. This is work that must be done, and we know that the investments that we secured for this and for STI treatments and for PrEP medications in the last 2 or 3 years were historic. I was proud to work with you to get that money into the budget, and so we got to stay really focused on that so that those resources don't get washed up into austerity discussions that are wholly irrelevant to whether people can live healthy in this state, and that we will have equity in the outcomes of our health indicators in this state. Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. And for more information on what I'm working on, please follow me on my social media using the links in the description below. Thank you.